Okay, anemia is our other big problem. Close to 5% of our female patients get anemia, and the first thing to do when we think about our patients with anemia is stop having your menstrual flow. And people get confused. They go see their doctor and they say they're anemic and they're giving them iron tablets and things like that. But that's not the first thing. The first thing you do is remember that men don't get anemia, women do. Even women who don't have my surgery have a 3% incidence of anemia in the United States. Our rate is higher at 5%, but it's related to the loss of iron during the menstrual cycle. So the number one thing, the first thing to do if you're having anemia is see the gynecologist and discuss with him or her interventions to have fewer menstrual cycles or lighter menstrual cycles. And then the number one thing that a lot of people talk about is they have some of the new birth control pills where you only have 2 or 3 cycles a year. Like that's advertised on TV, the Yaz commercials and stuff like that. The next thing is, of course, you're going to take some extra iron, but usually that's not adequate to repair because you can't get enough in through oral intake. But there's a big new development in oral iron. One of our patients, an oncologist from Michigan, just had surgery with me, and he has a lot of people with anemia, and the new oral iron is called Proferrin, P-R-O-F-E-R-R-I-N, Proferrin. You can get it on the internet, and it is heme-bound iron. The iron that you get in the tablets in the grocery store are iron sulfate, right, and that's rust.
So I shouldn't be taking that.
Rust is not well absorbed. Heme iron is the same kind of binding where the iron is in the middle of a ring of other molecules that's easily absorbed by the body. That's the way iron is linked up in muscle and in meat. So we can absorb iron from meat better than we can if we eat pure rust. So Proferrin is heme-bound iron. And several studies in dialysis patients have shown that Proferrin works well. It's over the counter. You get it from a company that invented it. It's called Proferrin, and it's a heme-bound iron. But the first thing to do is slow down the menstrual loss. The second thing to do is take Proferrin. And once you get low and you feel anemic, you almost certainly have to have intravenous iron for one boost to build yourself back up.
And my doctors talked about that. In fact, I'm so iron deficient that my menstrual cycle stopped altogether.
Right. Well, you need then the IV iron first, and then make sure the iron doesn't go out in the menstrual cycle in the future. But that means that means that your iron deficiency is so severe, you need the IV iron first, then the gynecologist, and then the oral heme iron.
Okay. So stop taking the iron sulfate.
Oh, it doesn't make any difference one way or the other. That does help a little.